Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dr. Rasha Abdul Mahdi. Today I'm going to talk about Enterobacteriaceae. My lecture divided into two parts. In part 1, I will talk about Salmonella and Shigella, while in part 2 I will talk about Klebsiella and Proteus. The main point of my lecture is understanding different examples of enteropathogenic microorganisms via introducing their characteristic features, antigens, epidemiology and diseases, pathogenesis, symptoms, and treatment. Before I start in my lecture, I would like to ask you why you are, as a pharmacologist, studied microbiology, or what is the benefit or the aim of that? In other words, how you can use microbiology in developing your major? To answer this question, first, you have to know what your message as a pharmacologist is. Can you think a little bit about that? Okay, let me help you. For me, as a microbiologist in a pharmacy college, my message toward you is show you most pathogenic microorganisms. In other words, inform you about the enemies of the human health and their properties, weapons, point of strength and weakness, their excursion in the body, as well as the available antimicrobial agent that could be useful to fight them. Briefly, I inform you all the keys of pathogens, and you have to think how to use them in investigating or developing antibiotics to overcome these microbes. Okay, let's start in my lecture. First of all, I will give you a general introduction about Enterobacteriaceae. So Enterobacteriaceae are large heterogeneous group, gram-negative, rod. Now, the question is, what is the benefit when I tell you these microorganisms are gram-negative? Or, what this information signal to? Does it mean there is a difference in the color of cell when staining? Is that benefit for you as pharmacologist? Okay, let me explain. Gram-negative and gram-positive mean there is a difference in the bacterial cell wall structure. And this figure shows the differences between gram-positive and gram-negative cell wall structure. So, as you show, gram-positive bacteria have a thick peptidoglycan layer and no outer lipid membrane, whilst gram-negative bacteria have a thin peptidoglycan layer and have an outer lipid membrane. As gram-positive bacteria lack an outer lipid membrane, so when correctly referring to their structure, rather than staining properties, are termed as monoderms. The outer lipid membrane possessed by gram-negative bacteria means that when referring to their physical structure, there are termed di terms. And as you know, as pharmacologists, the antibiotic acts via several mechanisms. One of them is the antibiotic interferes with cell wall synthesis. So, now depending on that cell wall structure, you have to prepare or investigate antibiotics against this type of bacteria. Second characteristic feature of Enterobacteriaceae is natural habitat in intestinal tract of human and animals. Third, some enteric organisms are part of normal flora, example Escherichia coli, whereas others are regularly pathogenic for humans, such as Salmonella and Shigella. Depending on the site or the source of infection, Enterobacteriaceae are classified to three groups: pathogens within and outside the enteric tract, as an example is Salmonella. And second group, pathogens within the enteric tract only, like Shigella. The third group, pathogens outside the enteric tract, such as Klebsiella and Proteus. Let's start with the first group, pathogens within and outside the enteric tract, and we will talk about Salmonella as an example of that group. Okay, let's move to Salmonella. The characteristic features of Salmonella are gram-negative rod, and we understand what is gram-negative. Second, motile with Britrichus flagella. Third, urease negative. So, the question is, what is urease? And what is the benefit of urease if it is found in this bacteria? Urease is an enzyme that catalyzes the hydrolysis of urea, forming ammonia and carbon dioxide, found in numerous bacteria, fungi, and algae. Therefore, the medium will be alkaline and balance the stomach acidity to protect the bacteria, as it happened in with Helicobacter pylori bacteria. 4. Do not ferment lactose, but produce H2S. What is H2S? The benefit, or what happened to the body when the bacteria produce H2S. H2S irritates the mucous membranes of the body and the respiratory tract, among other things. Following exposure, short-term or acute symptoms may include a headache, nausea, convulsion, and eye and skin irritation. Injury to the central nervous system can be immediate and serious after exposure. 5. Salmonella is pathogenic for humans or animals when ingested. The most common cause of foodborne disease in the world. Salmonella lives in the intestine of many animals, such as cows, dogs, pigs, and bears. But Salmonella typhi only lives in humans. This slide shows Salmonella antigens. Salmonella possess different antigens that are important for taxonomic and epidemiologic purposes. First, cell wall O antigen. Second, flagellar H antigen. Third, capsular polysaccharide VI or virulence antigens. Cell wall O antigens are the outer polysaccharides of the cell wall used to subdivide the Salmonella into groups A to I. Flagellar H antigen. There are two forms of the H antigen, 1 and 2. Only one of the two H proteins is synthesized at any one time. Capsular polysaccharide VI or virulence antigen. They are antiphagocytic and are an important virulence factor for Salmonella typhi, used for serotyping in the clinical laboratory. This slide shows the Salmonella classification. Salmonella are classified phenotypically and clinically. Phenotypically, Salmonella is classified into two groups. These are Salmonella enterica and Salmonella bongori. Most human diseases are caused by the Salmonella belonging to Salmonella enterica. Also, clinically, Salmonella are classified to two classes. These are typhoidal and non-typhoidal group. Typhoidal Salmonella causes typhoid fever and paratyphoid fever, such as Salmonella typhi and Salmonella paratyphi A, B, and C. While non-typhoidal Salmonella causes gastroenteritis and food poisoning. Example, or other Salmonella serotype. Let's move to transmission route or epidemiology and diseases of Salmonella. Human acquire Salmonella infection by consuming of contaminated meat or animals product. Example, egg. B. Via direct contact with infected animals or environments. C. Via contaminated food and water, utensils, hands of someone who handles food. The disease is caused by Salmonella. There are three main diseases caused by Salmonella. These are enterocolitis, enteric fever, typhoid fever and paratyphoid fever, and septicemia. Okay, this diagram shows you the pathogenesis of the excursion of Salmonella within the body during enterocolitis. As you see, the infection started with the ingestion of organisms that colonize our lower intestine, ileum and cecum. Then invade mucosal membrane, producing cytotoxin, causing acute inflammation that lead to stimulation of ulceration, prostaglandin synthesis, enterotoxin and cytokines production, which causing the activation of adenylate cyclase and increasing cyclic adenosine monophosphate, which lead to fluid production in large and small bowel, causing diarrhea. What is prostaglandin? Prostaglandin are a group of physiologically active lipids made at site of tissue damage or infection that are involved in dealing with injury and illness and having diverse hormone-like effects in animals. They control processes such as inflammation, blood flow, the formation of blood clots, and the induction of labor. What is cytokines? Cytokines, any of a number of substances such as interferon, interleukin, and growth factor that are secreted by a certain cells of the immune system and have an effect on other cells. Phagocytes themselves also secrete cytokines, which influence the behavior of other cells. What is cytotoxin? Cytotoxin are polypeptides that cause structural cellular damage and an inflammatory response by a variety of mechanisms, such as blocking protein synthesis or hampering the formation of energy-rich intermediates and interference with the normal assembly and turnover of the cell junction and the cytoskeleton. Now I'll move to explain the pathogenesis of Salmonella typhi and paratyphi during typhoid fever. As you see in this diagram, the infection started with the ingestion of contaminated food. Then, ingested bacilli will invade small intestinal mucosa. Invasion or invade bacilli will taken up by macrophage and transported to regional lymph node. After that, Salmonella typhi multiply in the intestinal lymphoid tissue, intact with enterocytes, and M cells, ileal Bayer's patches. During 1 to 3 weeks of incubation period, they produce diarrhea. At the end of incubation period, bacilli enter bloodstream causing bacteremia phase, onset of typhoid fever. Then, bacteria invade the gallbladder, biliary system, and lymphatic tissue of the bowel and multiply in high numbers. Finally, pass into the intestinal tract in the stool. Okay, this slide illustrates the symptoms of typhoid and enteric fever. There are many symptoms associated with typhoid fever. These are fever and constipation, bacteremia, delirium, enlarged spleen occur, rose-colored macule on the abdomen, leukopenia, anemia, and abnormal liver function. The disease begins to resolve by the 3rd week, but severe complicated, like intestinal hemorrhage or perforation, also can occur. Okay, let's move to talk about third disease caused by Salmonella, which is septicemia. In general, septicemia is invasion of the bloodstream by virulent microorganisms, and especially bacteria, along with their toxin from a local seat of infection, accompanied especially by chills, fever, and prostration, called also blood poisoning. Salmonella septicemia occurs in one of two settings. First, patient with an underlying chronic disease such as sickle cell anemia or cancer. Or, second, a child with enterocolitis. The septic course is more indolent than that seen with other gram-negative rods. Bacteremia result in the seeding of many organs, with osteomyelitis, pneumonia, and meningitis as the most common sequelae. A child with osteomyelitis and sickle cell anemia is an important example of this type of infection. Septicemia is most often caused by Salmonella chlorosis. The symptoms begin with fever, but little or with no enterocolitis, and then proceed to focal symptoms associated with the affected organ, frequently bone, lung, or meningitis. In this slide, I will show you the available treatment used for treated Salmonella. So in enterocolitis, after a few days, the disease usually self-limited, causing non-bloody diarrhea, and do not require medical care, except with very young and very old. Fluid and electrolytes replacement may be required. Second, in enteric fever, typhoid fever, and septicemia, either ceftriaxone or ciprofloxacin. Ampicillin or ciprofloxacin should be used in chronic carrier patients. Cholecystectomy may be necessary to abolish the chronic carrier state. In this slide, I will transfer to talk about Shigella as an example on the enteric pathogen only within the intestine. First of all, I will talking about the important properties of Shigella. Shigella are broad shape, gram-negative, non-motile, non-spore forming, non-encapsulated, vacuolative and aerobes. Do not ferment lactose or do so slowly. Do not produce H2S. Highly infectious bacteria of the Enterobacteriaceae family. Shigella are classified to 4 species or serotypes. Serotype or serogroups A involve Shigella dysentery, which include 12 serotypes. Serogroup B involve Shigella flexneri, includes 6 serotypes. Serogroup C involves Shigella boydii, which include 18 serotypes. And serogroup D involves Shigella sonnei, which include 1 serotype. Note: Shigella dysentery is considered the most virulent and can produce abundant cytotoxin, known as shigotoxin. But Shigella sonnei is most common isolated species worldwide. Shigella cause diseases called shigellosis, which is also called bacillary dysentery. Shigella dysentery type 1 causes the most severe disease and responsible for cases in which hemolytic uremic syndrome develops. Shigella sonnei produces the mildest form of shigellosis, usually watery diarrhea. Shigella flexneri and Shigella boydii infection can be either mild or severe. So, this slide shows you the route of transmission of Shigella. Humans are the only host of Shigella. Fecal oral route is the primary means of human-to-human transmission. The 5 F's of disease transmission are food ingestion, such as water, food, drinks, flies, vomit, taps, toilet, seats, etc., fingers, and feces. In this slide, I will show you the pathogenesis or the excursion of Shigella in the body. The mechanism of shigellosis involves enterotoxic or cytotoxic diarrheal prodrome cytokine-mediated inflammation of the colon, necrosis of colonic epithelium. As you see in the diagram, infection of Shigella started with ingestion of bacteria that are taken up by M cells and then transported beneath the epithelium, taken up by macrophage. The macrophage that take up Shigella die and release the bacteria. Then the released bacteria enter the epithelial cells by endocytosis. By quick lysis of endosomes, Shigella will be free in the cytoplasm. The actin filaments will be quickly forming. Form actin filament will push Shigella into the next cell, which multiply and spread infection to the next cell. Infected cell die and slug off, causing acute inflammatory cells, neutrophils, bleeding, and abscess formation. So what is the symptoms that associated with shigellosis? Acute intestinal infection upon ingestion resulting in mild watery diarrhea to severe inflammatory bacillary dysentery or shigellosis, manifested by severe abdominal cramp, nausea and vomiting, fever, tense muscle, anorexia, and stool containing blood and mucus. Further complications include Reiter syndrome, which has been associated with Shigella flexneri, severe dehydration, intestinal perforation, toxic megacolon, bacteremia, toxemia, septicemia, seizure, toxic encephalopathy with headache and alteration of consciousness, septic shock, and convulsions, very rare. And hemolytic uremic syndrome, which have been linked to Shiga toxin. Potent cytotoxin produced by Shigella dysentery that can also cause other necrotoxic effect. Okay, let's move to talk about the infectious dose and the available antibiotic to treat shigellosis. Infectious dose are very little, as few as 10 to 200 cells can cause disease, depending on the age and condition of the host. The treatment of shigellosis is fluid and electrolyte replacement. In mild case, no antibiotics are indicated. In severe cases, a fluoroquinolone, example, ciprofloxacin, is the drug of choice. but the incidence of plasmid conveying multiple drug resistance is high enough that antibiotic sensitivity test must be performed. Trimethoprim sulfamethoxazole is an alternative choice. Antiperistaltic drugs are contraindicated in shigellosis because they prolong the fever, diarrhea, and excretion of the organisms. In this slide, I illustrated two questions for you. These are: first, what your message as pharmacologist is. Second question is, why you are studying microbiology? Or, what is the benefit of microbiology for you as a pharmacologist? Please think carefully and try to answer this question, even in Arabic. Thank you for your listening. Please don't hesitate to ask me any question about my lecture.